What was your question,
That'll be
Eddie?
an outtake.
What was your question, Eddie?
I said, have you ever heard of direct primary care?
I think so.
Okay.
I think so. And hey, by the way, we're live. We're on Facebook. I'm with Dr. Eddie Thomas. Eddie, thanks for coming on.
Absolutely. Thanks for coming here.
Eddie's been on the radio with me years ago, so
a lot more hair back then.
yeah, you did actually. And Eddie is an internal medicine specialist.
Right.
And you just asked me, have I ever heard of direct patient care?
Primary care.
Direct primary care.
Yes.
And I want to say I call this concierge medicine. So is that correct? Have I heard of it or not?
It's a little different than that.
Okay,
but there are aspects that are similar.
So what is direct primary care? And tell me what concierge medicine is and how that relates. Okay.
So they both have a fee. Concierge medicine is typically a higher fee than direct primary care is. With concierge medicine, insurance companies are still billed for visits. With direct primary care, the insurance company is kind of left at the door. So it's basically taking the insurance company out of the mix when you go to a direct primary care practice.
So let's say I go and I want direct primary care.
Right.
Or concierge. I would pay a monthly fee.
Correct.
Okay. How much would it be for me a month? One person.
For direct primary care in our practice, it's $60 a month.
$60 a month. So let's say I go to see you.
Right.
I pay $60 a month. I go to see you, and you know, you check my blood pressure. You listen to my heart. Do I then send the bill to my insurance company?
No, insurance company. You can come without insurance. Insurance company has no role to play in a direct primary care practice. So
Okay.
we don't file insurance. There's no co-pays. It's unlimited visits for that $60 a month. You could come every day.
But I still need health insurance.
Still need health insurance. So think of it as like you have insurance for your house, and that's for catastrophic events like a fire or something like that. But for plumbing problems or electricity problems, you just pay it yourself.
Okay.
So you have to have insurance for catastrophic events.
Now with concierge medicine, how much does that generally run? Do you even know?
You know, anywhere between $1,500 and $2,000, depending upon where in the country you do it.
Why is that so much more expensive?
Well, there are certain aspects of concierge medicine that there's a lot of connections with tertiary clinics, like say Mayo Clinic or Johns Hopkins. There's direct pipelines to there. You get a little more benefit for that. There's a lot of networks with some concierge medicines over the country. There's a lot of patients who have, say, doctors in Alabama. There may be, like for MDVIP, there may be physicians in other parts of the country. So if you're on vacation, you can always pick up the phone, call your primary care doctor, and they can hook you up with an MDVIP doctor somewhere else in the country.
Wait, I'm still confused. I don't understand why concierge medicine is $1,500 a month and you're $60 a month.
There are some specialty labs that are run for concierge medicine that are a little bit more highly specialized. So basically, you're paying for those labs with that price.
So let's say that I've been a patient of yours for 20 years, okay?
Right. Okay.
And all of a sudden you say, hey, I'm done, I'm going into this direct patient care,
Mm-hmm.
and you have to pay this monthly fee.
Right.
You know, let's say I'm an uncomplicated patient.
Mm-hmm.
Maybe I'm just going to say, no, I'm going to save the $60 a month.
Sure.
But let's say that I've got diabetes, congestive heart failure,
Right.
and lots of other chronic diseases, and I'm a high patient burden.
Mm-hmm.
$60 a month seems pretty cheap.
It is. It's very cheap, actually.
Because I'm going to be calling you probably
Right.
every month.
Well, that's the thing. You get my number, my personal cell number to call me after hours and on weekends. So you're not going to talk to a nurse practitioner that doesn't know you or another physician that has no idea who you are. There's a relationship that really makes a huge difference in that type of a practice. So you can call me, you can text me, you can send me pictures of a rash you may have that you're
But
not sure
again,
about.
that would be the same as a concierge medicine. I'm still confused as to why that's so expensive.
Again, the specialty labs that are run is basically because you get.
What's an example of a specialty lab?
They do a lipid profile that is a lot more specific than a normal lipid profile that you get at your internal medicine physicians. They break down LDL, they break down the HDL.
But why wouldn't you run that?
Well, because some of those things aren't necessary.
What if it was necessary? You would
We
run
can
it.
them, right.
And so what would that cost and how would I pay for it?
Typically, the labs for Concierge Medicine is somewhere around $2,500 to $3,000 for all of those specialty labs. There are inflammatory markers that are run, that are screening tools for coronary disease and things like that.
But wouldn't I be able to get my insurance to pay for that?
No, because they consider that unnecessary.
I see.
Yeah.
Okay.
And that's the thing.
So this next question's obvious, but I'm gonna have you reiterate it
Sure.
again. And this time I want you to compare direct patient care to just me going in and seeing you when you were in just primary care internal medicine.
Okay.
How does going with DPC save me money?
So it's unlimited visits. You don't have to worry about copays.
Mm-hmm.
So a lot of people don't want to go to their doctor because, well, I'll just suck it up and go through this illness like a cold or something and not go because I don't want to spend that $35 copay.
Mm-hmm.
You can come as many times as you want for that $60 a month. Typically, you don't get to speak to your physician. You have to go through nurses, and at night, sometimes he's on call, sometimes his partner's on call.
Mm-hmm.
With direct primary care, you get the doctor that you see every day.
Okay. What if you go out of town?
Doesn't matter.
Mm-hmm. They
can call. If I'm out of town, they can call me directly. They can.
Do you
text
have
me.
a cap as to how many patients you will allow into your DPC?
Somewhere around 500 to 600 patients.
Okay, and where are we at here?
Right now, we're just getting started, so we've got around 30 patients right now.
Okay, so we're just starting. Okay,
Yeah,
so I caught you at a
early.
good time.
That's right.
So these people need to know. I deliberately wanted to sit here because, I don't know, it's not often that I don't know. I don't walk into a lot of primary care doctors' offices, so maybe,
Right.
Maybe having vitamins and herbs is more common, but
Not
typically I don't think of that as more common. So that suggests to me that you're into some integrative type of stuff.
Right.
More, I don't want to call it non-traditional, but maybe I'm going to use a euphemism here, more integrative type stuff. And
Right.
so, what are you into, Eddie? What have you gotten into here?
Well, a lot of these things are natural, and a lot of the things do work. The herbal medications, a lot of people go into holistic medicine now, kind of combining general, traditional medicine with holistic medication. So these are all medical grade herbal medications, not the things that you get online or that you see in the
But why
in
these
Walmart.
particular products? Is there anything special about what we're looking at here?
Yes, sir. So there's
So
a lot
pick
of,
out maybe one that
well, I'll tell
you think is kind of
something
neat.
that I take.
Okay.
Theracumine HP is excellent for chronic joint pains and arthritis, something that you might be interested in because that's what you do every day.
Exactly.
The chondroitin sulfate, you can get that glucosamine synergy. This is also for building joints. And to be honest with you, and I'm not just saying this, my joints have not hurt since I've been taking these two medications. There's a medication called Lavella. We have a lot of patients who have anxiety and depression. Lavella is actually just a natural herb made from lavender flowers.
How much are these?
These
About just ballpark.
around $30 to $40.
Okay. And this would be extra,
right.
right?
These-
And
that-
there's
that
a
would not
question
be
that came
included.
in. It
Yeah.
says, "Do I need insurance for DPC?"
Do not need insurance at all. Insurance is not a part of this. It goes on and just it threes a crowd. It's just me and the patient.
And so for $60 a month,
Right.
kind of like a subscription service,
Exactly.
I have
Total
Doc Talk.
access.
I have Doc Talk Live
That's right.
whenever I want with Eddie Thomas. Is what
Exactly.
you're saying. But let me just say, I think people still need insurance.
No, we're not saying they don't. Like I said, you need it for hospital and you need it for catastrophic events that happen as far as medical issues go, heart attacks, strokes, things like
Right.
that.
But
for
plus,
your-
you might see somebody who you feel needs a cardiology evaluation, and they're going to end up getting cathed,
Right.
or a treadmill, or an echo, or these specialized tests.
Right.
They're going to need insurance for that.
Sure, absolutely.
All
So
right.
no, we don't replace insurance at all.
Okay.
This
But
is
you
just a
don't
lot
need
more-
insurance.
That's right.
Um,
And if I might say, this is a really good program for employers who may not be able to pay for their employees' insurance,
okay.
or even if they do pay for their insurance. We're going to cut costs because we're going to be accessible. Their employees can come anytime they need to come. We can keep them on the job. They've got happy employees. There's no co-pays to worry about.
Here's another
Yeah,
question.
sure.
If I have insurance, will you file?
No, we don't file.
They do not file. Okay.
No,
But you shouldn't need to file because you're not really charging them
correct.
for an office visit,
Right.
right?
Right.
Okay.
Yeah, we don't file.
Okay. I'm going to switch gears on
Okay,
you,
go
but
ahead,
I'm happy to
Yeah,
keep
that's
talking
great.
about
Great
DPC
questions.
if these questions come in.
Sure.
But weight loss.
Right.
It seems like you've been doing weight loss a while now.
I have been.
How long have you been working on the
Probably
weight
about
loss?
10 years now.
10 years. Okay. And so how does weight loss, let's say in your practice, differ from, let's say, bariatric surgery?
Well, we use medications.
What medication? What's the big medication you use?
We usually use phentermine, which has been around for a long time.
Phentermine. Okay. Did I
Yeah.
say that right?
You did,
Phentermine?
Phentermine.
Okay.
Right.
What is that?
Atipex was the old brand name.
What is that?
It's an amphetamine derivative, so it is controlled. So it's something that you can only get once a month.
Hold on, I'm going to
Yeah,
interrupt you
sure.
because I really the questions that come through this are more
That's
important
great.
to me.
Sure.
But so I don't need to worry about a high deductible.
Exactly.
Exactly.
That's right. Yeah. No need to worry about that.
Okay.
In fact, you can adjust your insurance if we do a good job and we see you and prevent a lot of things, then and you're only paying $60 a month, and you come unlimited. There's no copays. Then you can go for an insurance plan that might save you some money. Instead of going to the gold plan, you can go to a bronze because you're paying less.
Okay.
So
All right. What about my medication?
medications we dispense here. We have blood pressure medications, antidepressants, antibiotics, cholesterol medications. They're all generic. We don't sell any brand name drugs because obviously those are expensive. But the cost of those drugs to us is a lot cheaper.
So, but that's extra though.
No, that's included. Well, yeah, they'll have to pay extra for the prescription, right?
That's right. So it's $60 a month, but if they need a drug like an antibiotic, you're going to
Yes.
give them a generic.
Most
That's
of it's going to cost $5 to $10 at the most. So they're
Okay.
a lot cheaper. We can match or beat any price the pharmacy has because we just order directly from pharmaceutical supply companies.
okay. But what if they need a really expensive drug, like for rheumatoid arthritis, like some injectable drug?
That's gonna be
Again,
on
you need
dollars.
insurance.
Yes.
The-
For
the-
those medications, yes, you'll need insurance.
Okay.
Those are going to be high.
Okay. I need to get this
yeah.
woman in here because
Yeah.
she's asking the better
And-
questions
and-
than I am, I
and
think.
Now, your physical, everything's included. All the labs we do are included in that. You get an EKG and you get a circulation test.
So
which
do
is
you
called-
run your own labs? Do you have
No,
you
we
have to
send
send
those
that out? So that costs you money.
Right, but we can get it cheap because we go directly through the lab company. We don't have to go, when you get an insurance bill, sometimes if we don't put the right code or we order a test that the insurance doesn't feel is necessary, then the patient's going to get a bill for $75, $100 because insurance is not going to cover, so they have to pay the rest of the cost.
Okay.
But with us, you don't have to worry about that. We're going to give you a lab test that's going to be inexpensive, $10, $15. I mean,
I tell you what I like. I like the fact that I think $60 a month is reasonable.
It is reasonable.
But then you're also getting that urgent care solution.
right,
Of
keeps patients from having
something
to go to urgent
something
care.
comes up. You don't have to.
exactly.
You can get an appointment or you can get access quickly.
Yep.
On top of that, if I had a chronic disease,
Mhm.
it becomes a no-brainer.
Sure.
All right, back to
urgent
what.
care is going to cost you $300 just to walk in the door.
Yeah, back to weight loss now.
Yep,
So
sure.
what's different about a medical weight loss clinic versus a bariatric surgery?
Well, they're doing an invasive procedure on you.
Right.
But we go. We have two different diets. We can do the keto diet with you. Typically, our most popular diet is low carb, low fat. So we counsel patients every time they come in on that diet. We go over it extensively the first visit.
Is there ones with injections? I hear about people
There's a
doing
lipo
injections.
injection, yes.
What
and
is that?
There are 3 amino acids that are in the injection of B12, and they help increase your metabolism, and it gives you a little boost of energy. Those are the lipo shots that you hear people are fat burning shots. That's the same thing. Most
How
everybody
often do you
uses.
do that?
You get those once a week.
Okay.
There's a liquid form if you don't like shots. We have the same exact stuff in a liquid form that you can take once a day.
Do they give themselves their own shot once a
No.
week, or they have to come in for it?
They come in for it once a week.
Okay.
Now,
What's the HCG? Is that done with now?
that's done with. Nobody uses that anymore. That's been very highly discouraged.
Okay.
That was
Why is
popular
that?
back. Because it doesn't really work that well because you go on a 500 calorie diet, so you're going to lose weight because you're on a 500 calorie diet. And HCG obviously is a hormone that you don't need to be taking a lot.
Okay.
There's side effects to it. So that's why it's not used anymore.
Okay, so
It was
you do
stopped
the
before.
lipo shots, and then there's also
Diet.
the phentermine.
Right, no,
but the key is how can you eat 500 calories a day and not kill somebody?
Right.
Right? Because
No,
when
we
I'm
don't do 500 calorie diets.
oh, okay, because I get pretty hangry.
We also do an in-body analysis, which gives us your percent fat, and that's basal metabolic rate.
Okay,
That's
I'm
how
going to
we
have you
determine-
hold that
Yeah, man,
because
go ahead.
better questions are coming in.
Sure.
If I saw you for weight loss, what comes with my first visit?
So you get an EKG, you get chemistry profile, which is a lab checking your kidney and liver functions. We do an A1C level to screen you for diabetes, and we do a thyroid test called a TSH, which tells us how your thyroid is functioning because that regulates your metabolism. You'll get an in-body analysis, which gives us your percent body fat. It gives us a basal metabolic rate, and based on that basal metabolic rate, that's how we determine what your calorie diet is going to be. And then you get, a sit-down and exam.
How much is that?
It's $129 for a new patient.
So why don't I just sign up for the $60 a month and let you just do the weight loss with me?
We do that. You'll get a discount if you sign up with THS, Total Health Solutions. You'll get a discount for weight loss also. So you'll get discounts on the prescriptions.
But why can't that be part of my THS?
Well, it is. It's not a separate charge, but you do get a discount. So you'll get a discount on your medications. We dispense the meds here. Normally it's $35. You'll get it for $25, and then you'll get a free shot.
But how much is the first visit with the weight loss? Sorry to harp on money, but
It's
I think people
$129.
want to know this.
$129.
It's $129 for the first visit.
Correct.
Again, why wouldn't I just do $60 a month and then get my medications at a discount? Why even bother with Solutions Weight Loss? I'm just confused there from a financial
I understand
perspective.
what you're saying, but you will get that lab work, and you will get that exam, and you will get that analysis. So it's
Golly, more good questions are coming in. Let's see. I can't go back, so I'm sorry.
Okay.
Something about $60 help with those. I don't know. Please rewrite that question. Will you see my son who is 16 for this?
that's our cutoff. Yeah, 16 years old is our cutoff.
Why won't you see a 15-year-old?
We just chose 16 as the cutoff.
That seems pretty arbitrary, Eddie.
I can't give you a scientific reason. I'm not a pediatrician. We're a family practitioner, so 16 is the cutoff.
All right.
We also use other weight loss medications. We use metformin. We use Topamax. So we don't always use controlled substances. We use something called 7-ketolene, which is a natural appetite suppressant too. So it's not always phentermine. That's probably the strongest that we use. But you can't take that forever. There are side effects to that. It's an amphetamine derivative, so it can stimulate you and raise your blood pressure, so we don't like to use it for very long. So
What about the new med Contrave?
that's a prescription that you'll have to get at a pharmacy. We don't sell that here.
What is it?
It's a combination of Wellbutrin and naloxone.
Wellbutrin and naloxone.
Yeah.
Why naloxone?
They've just found that it helps with weight loss.
Now, naloxone is like, is that a partial opioid painkiller?
It's the antagonist.
It's
of
the
that.
antagonist.
Right.
Okay, so
So
it's what people take to try to get off opioids
Right.
with Wellbutrin.
Yep. But it's very expensive.
Why? Okay.
Because
What
it's
if,
new and it's brand name.
what if they took just Wellbutrin and naloxone? Would that be cheaper?
I don't know. It all depends on the pharmacy. Yeah.
Okay. And how do we know how it works? Any ideas? Any thoughts? All right.
Wellbutrin has been used for weight loss in the past, but they've combined it with naloxone. So.
Okay. And it's also being used for smoking cessation,
It has.
right?
Yep.
All right. A few more questions about weight loss.
Absolutely.
I'm just,
You're
I
fine.
was thinking about Wellbutrin got me thinking about smoking, which got me thinking again
Sure.
about weight loss,
Yeah.
which is weight has become like smoking. When we trained,
Mm-hmm.
we were, smoking was the biggest problem.
Right.
Now it's got to be weight. Any just sort of general thoughts about the obesity epidemic in our society?
Well, a bigger problem is diabetes because of obesity. So when you have extra fat in your body, it causes something called insulin resistance, which means that the insulin you produce doesn't work as efficiently. So your pancreas has to work harder, and as your pancreas has to work harder, it's like driving a car at 100 miles an hour. The engine's going to burn out a lot faster. So over time, the more fat you have, the more insulin resistance you have, the more your pancreas has to work, and finally you start developing diabetes because you can't keep up with the carbohydrate metabolism. So
All right, let me
Go
just
ahead.
read Carrie.
Yeah, ma'am.
Don't most health issues need blood work or testing for diagnosis? How would $60 help those problems? Well, let me try to answer this if I got it right. So the answer is yes, a lot of health issues need blood work. The blood work is included with the $60. If you need really specialized expensive labs, that's not included.
Right, we can order those.
But they can be ordered.
But they'll have to.
And once again, that's why it's good to
There'll be
have
an extra cost.
health insurance. But the $60 a month, you don't have to have health insurance for that.
Right.
It's
But
sort
your
of
physical-
like a
on your
insurance.
physical exam, you get the whole battery of tests. But if we have to order another test, like say we get a blood count one day, it may cost $10 for the patient. That's
Okay.
just extra.
Okay. All right. I don't know. It seems like a good thing to me. I can't really. This seems like.
Well, it definitely is going to make a huge difference. It started out in the Midwest, but it's moving this way. But it has definitely made a huge difference in healthcare costs. You're bringing costs down because accessibility of the physician. You're bringing costs down because you're distributing medications at a much cheaper rate, much cheaper price. You're doing labs much cheaper. So you're actually saving the insurance company money too, because they're not having to pay all this extra money to a lab or a pharmacy for expensive medications.
Okay.
So, they may have to pay $300 for a lab test,
Okay.
and we can do it for 10. Like a lipid profile is $142 if you had to pay for it. We can do it for 10.
Okay.
So.
Well, Eddie, I know you're a great guy, and I've
Thanks,
always
man.
loved working with you, so I appreciate you coming
Likewise.
on. And I think that, hopefully in a couple months, maybe we can
Yeah.
do another
Touch base
show
on
and see where we're at. And I think that this is the DPC, direct patient care, is. I'm glad we're able to at least inform somebody
Sure. No, I
that
think,
this exists.
Absolutely.
I think $60 a month is reasonable, but I would tie it into the weight loss. I mean, I'd want both for my money. Let's see if there's any more questions.
All right.
Do you treat with low testosterone?
Yes, we do treat low testosterone.
So, do you use testosterone to help weight loss, or do you have to document that the testosterone is
No,
low?
we don't use testosterone for weight loss. We do have low testosterone in the clinic. I mean, some men come in, have symptoms of fatigue, listlessness. Some people have ED. So
What
we
if your
check-
testosterone is normal?
Then you don't need testosterone.
Then you're fatigued for some other
Yes,
reason.
that's right.
Okay.
So yeah, we do check for that.
All right. Well, keep the questions coming, because perhaps, Eddie can answer these questions too,
Yeah.
or maybe somebody from his staff.
Right.
And I'm going to cut it
Come
off
in,
there.
meet us, talk to us, see if it fits your health style. So.
And I appreciate all the questions that came in. Whoever asked these questions, they were excellent, and it just makes this a whole lot
Sure.
more fun for me, because it's
Right.
really not about, I'm just trying to ask the questions that y'all are interested in, and
Right.
I don't necessarily always know that. Okay, I'm going to hit finish.
Okay.
All right, thanks, Eddie.
Thank you.